We again have Professor Rulisa in our studio. He's not our first time guest here in the studio. He's been here for different times. And today he's here to tell us more about their recent article that was published. And recently they published a compelling article that raises deep concerns about the potential consequences of reduced global development assistance, particularly for the health and well-being of women and children in low and middle-income countries, as Rwanda continues to make strides in improving its health sector. We explore how decisions made beyond our borders. I mean, thank you so much, Professor, once again for joining us on this podcast.
Thank you for having me.
It's an honor. We don't take it for granted. We appreciate your time. We know you have limited time reading a lot of things. You do a lot of reading, you do a lot of travels and everything, but you spare time and come to check on us and share your knowledge. Professor, tell us about the recent research that you published on the withdrawal of USAID and these other fundings that were going into health. What is it about that research? What can you tell us about the research that you published?
It's first of all, it's not a major research.
It's an article.
So I was when USAID withdrew the funding they had in general, but specifically for health. I was contacted by a group who knew that who knew my expertise and who knew that I was embedded in doing research in maternal and child health and trying to use data for evidence-based policies. And they asked me the impact of USAID withdrawal funding to especially developing countries. My answer at first was that I don't know. It was still fresh and we don't know what is going to happen. They insisted. After a few weeks, they said, okay, can we put it together what we have? So I asked several of my networks globally, and we tried to inquire about what is happening and try to assess the situation. So that was the paper about, there is not a specific finding we found about USAID alone because that was embedded within many governments. So the paper was assessing the impact in general as early as possible. And I think more consequences or impact will come later. So that was what we did, yeah.
I mean, if we've seen it withdrawing and a lot of, projects were hindered, I'm wondering, in maternal and child health so far, what is it that was really highly impacted that you might be knowing some projects that were ongoing that you think were highly impacted here? And of course, that maybe you're looking for funding from different other partners.
Yeah, of course, there are several. I will not mention countries, but since then I visited at least 3 countries and I inquired. It wasn't my main mission to ask about USAID. I was going on other my routine work, and I asked everyone would more than once talk about withdrawal of USAID funding. And the question I found is that the biggest impact was on consumables. Somewhere they were procuring consumables, let's say, in newborn health, let's say they were buying consumables, medications that would save lives. In maternal and child health, for example, buying consumables, medications that stop bleeding, for example, prevent eclampsia. And if they withdraw, and the governments were not given time to look for other funding to bridge that gap, it was an overnight freeze. So there was a huge burden on the strain
consumables.
On consumables and other programs that they were doing. So that is some country report told me last week that they were procuring some malaria interventions like mosquito nets and so on. Now malaria cases are surging up. Again, I could not quantify these numbers in isolation of existing government programs, but for sure there is a significant impact in some countries.
Oh, wow. So, of course, the same is happening here because they were still doing the same funding. So, are you aware of any other options that we've really empowered in our country that?
When I compared, first of all, it was very difficult to know how much precisely and to what sector. Rwanda operates differently. They work within a government prescribed programs. So they support existing programs. So you cannot know, it's very, very difficult to know impact in isolation because these are the monies that goes to the government monies and mixed up and does programs.
It's not a standalone
It's not a
fund
standalone
that
fund
funds
that was
something
there.
and then when it gets
So-
out, it's a
and
complete
you can
debt.
see 100%. So Rwanda, you could say we're just blessed in a way that these policies of the government took this move many years ago to say donors will work within government programs and support existing programs. So when you withdraw this funding,
Don't initiate your own program.
you can't just go in isolation and do some project. In other countries, it's different. So in Rwanda, I couldn't identify a significant impact in isolation. In other countries, it's visible because you would say this hospital is run by that NGO. That district was supported by this NGO, this program. And when it was withdrawn, the impact is significantly felt. So it's different in Rwanda because of the setup of government policies. Yeah.
So in your article reference, I mean, you references the Copenhagen consensus highlighting an 7% return for every dollar invested.
Yeah.
What is it?
In the
What does it mean?
Copenhagen consensus says there's a huge amount of data and research that has been done globally. It started many years ago at the time of before Sustainable Development Goals, before SDG, before at the time of Millennium Development Goals. It was already doing research. Among the research, they discuss about the policies and they say, if you have a certain amount of money, we all have a limited amount of money. We never have more than enough. And so it says, if you have this amount of money, where would you invest it best to have maximum results? And so they analyze several policies. Let's say if you invest your money in environment or in agriculture or in climate change or in maternal health and so on, they found that there's a huge significant return on investment if we talk about the pure economics. If you invest your dollar in maternal and child health, it yields $1, $87 in return. So it's one of the profitable businesses you can ever do globally. So this paper is published. There's no question about the evidence. So it says if you invest in maternal health, as a country, as a society, as a world, you gain much more. So that means that every dollar invested in maternal child health yield $87. So in this cost analysis, it shows it's more profitable and you get rewards that are more significant when you invest in maternal child health. Yeah.
Okay. So, in your view,
Yeah.
do you think Rwanda is anywhere close or ready to standalone own the maternal and child health programs?
Oh, no question. I think I told you about reduction in maternal mortality, and when I see the interventions on the ground, we are all now being benchmarked globally on SDGs, Sustainable Development Goals, and every country is working towards achieving them. The assumption is that these are minimum, of course. If you achieve them, you have done your best, and you can even continue making progress. I will tell you that if in the last how many years we let's say maternal, if you reduce women who die from over 1,000 to close to 100, this is more than 90%. We can achieve the SDG target of 70. We are almost, I think, 105. And so reaching 70, I think, is doable. So we know what to do. We know how to do it. And we have minimum support in terms of finances. I have no doubt that we can achieve SDGs. And especially that our population is getting mobilized, they can now. So when you read about health indicators, for example, what stops women from accessing care, there's a lot of things. There's care, there's affordability, there is accessibility. Can you access health services? Can you afford the health services? And do you get the quality health services? Now, in Rwanda, for example, with our community health insurance, which is very high, every woman, more than 90%, I think, of the population have insurance. The question of affordability is out of place. Everyone can afford basic health care. The question of accessibility is also not a problem. There are health facilities now, they are putting another layer below health center called the health posts. The community health care workers are also being trained to do a significant amount of work. So if you solve the question of accessibility and you solve the question of affordability, we are almost there. So I think I have no doubt that we can achieve these targets.
As we conclude, if you had an opportunity to sit on the same table like this with the person responsible for cutting these funds, what would you tell them?
Cutting these funds?
I mean, the funds for maternal and child health. I mean, like the USAID's bosses and these others.
Well, I would prefer to sit with the people who own the countries and tell them, be prepared and own your own health system. Well, I have no control over people who cut their fund. This is their money. They can use it the way they want. But if they want my advice, I would say in future, if you put your money somewhere, it's better to alert people ahead of time and say, I will cut the funds in 10 months or 6 months, so be prepared. But, well, if they choose that, well, I don't think I can do anything. The best way would have been to tell the countries that we are going to stop funding in this kind period, in 1 year, in 6 months, so that the countries can be prepared to bridge the gap. But stopping abruptly, I think, is not good.
But in your perception, I mean, what do you think lags us behind, more especially Africa, when it comes to funding our own projects? Because we are capable of that. Everywhere you go around in Africa, what do you hear people say? What do you hear people say about that? Because
leadership.
It's like they don't care.
It's leadership. I believe, I may be wrong, I believe every country or every society has a minimum amount of resources to cater for their own people. Now, the next question is, how do you allocate those funds in terms of priorities? So
I was asking you about the notion. I mean, the Africans, we don't really give much attention to funding our own projects. It's like we're all holding our hands and saying, please, just support me. And I think in the health sector is where because when you look at, recently I was seeing the UNAID's boss, Winnie Byanyima. I saw her on one of the interviews saying that in some countries, people have already started to experience serious impacts of the cuts on the AIDS sector, area where some can't now access the drugs, the viral, they're called what?
Antiretroviral drugs.
Yes, ARVs.
Yeah.
And I was really wondering, it's just 1 month, and the government cannot even procure drugs for 1 month. People are already now, starting to feel the heat.
Yeah.
Why most Africans, most African countries don't bother about their population? I mean, and just wait for people to support them.
Well, I in the first place, I think it's high time that we stop generalizing countries and say African. There's nothing like all Africa. Countries are different. Countries are managed differently. Programs are managed differently. So when you look at the indices, not all African countries are the same levels. For example, even if you go to this funding, not all the countries had the same amount of funding. There are some countries which even refuse some donor money because they want to do they want to bite what they can swallow. And so there's nothing like why Africans, why Asians. Now, this is a trend in developing countries. Also in South Asia is facing a lot of maternal mortality and many other issues. So it's not an African problem. And even in Africa, when you unpack the whole continent, different countries do things differently. Now, if you want to ask countries that have been big hit, the answer is that I don't know. But I can tell you what I know in the few countries that I saw a difference. The simple, easy answer is about leadership. We now have evidence that it's not about natural resources. It's not about where you are located, that you are not a landlocked. Maybe when you have access to the sea, you become richer. Or maybe when you have petrol or you have diamond, you become richer. It doesn't explain everything. Now, these are good opportunities to have, but there's now common knowledge that if you remove one element, which is leadership, all this becomes futile. And so I think if government had good leadership, they can manage their healthcare, they can manage their transportation, they can manage their finances properly. So I think it's not an African, it's a specific developing world, but different countries are different levels. Yeah.
As our parting conversation, what would you tell someone listening to us that all we can do to protect the health of our children and women? And because mostly, let's speak to the men, we don't play much role in the health of women and children. But what can we do? I mean, what would you tell a fellow man if you meet them?
I think we should do what any responsible person would do. You just own your life and know your family belongs to you, your country belongs to you. Whether you are an individual or in any small leadership position, you have a role to play. You can't just say you are insignificant. If everyone did their best wherever they are, whether it's a family level, community level, country level, I think we can achieve most of the problems. If everyone would be responsible, that their contribution matters, and we all behave consequently in terms of delivering whatever we can deliver, I think that would be the best we can all do to ourselves. Now, the other donors and friends elsewhere, they can come, not a problem, but we need to be responsible for our lives in the first place. Yeah.
Thank you so much. Thank you so much, viewers of the Voices podcast. And we are stopping here. And today our guest, as you've seen, is Professor Rulisa. He has shared a lot about what has been happening, the cuts of the funds from USAID and these other institutions. But of course, he's telling us we need to own our health sector. Countries need to own their projects so that they can really provide for their population. See you next time when we have another guest on our podcast. Bye for now.